We received a question from someone recently asking, what is a coronal brow lift? Now, there are lots of ways to raise the brow, sometimes just with energy, sometimes surgically. It can be done with tiny little incisions in a minimally invasive technique, and it can be done with a very invasive technique, and that is what the coronal brow lift is. Now, a coronal brow lift is called that because of the type of incision. It's a coronal incision that starts on one side of the head and goes all the way across to the other. You actually lift everything up, put it into a newer, higher position, and then remove the overlapping skin, and so it closed. It's a pretty big operation, and it's not typically done anymore. That is the exposure for doing certain types of neurosurgery or cranial surgery. We don't do it for aesthetic purposes anymore. The most common way to do a brow lift is using an endoscopic technique. An endoscopic brow lift has little tiny incisions, usually 3 to 5 of them, and going under the skin through these little incisions using a camera and long instruments achieve the same end result. Raise up the brow, get it to a higher position, and hold it there. So the coronal brow lift is really more of an historic procedure that nobody does, but it was a pretty big operation and was a very effective way of raising the brow before we had other techniques. Now, the endoscopic technique, or even using energy like soft wave, can give you a nice brow lift with a much less invasive approach.